Hello, I'm Teresa Wilson, President of the Vow Foundation, here with Brittany Pickle, a certified peer with Barnum Family Services, for a spotlight interview as part of the 2020 Oswego County State Fair. Hi, Brittany.
Hi, how are you?
I'm good, thank you. Can you begin by telling us your name and title at Barnum?
So my name is Brittany Pickle, and I'm a certified peer at Barnum Family Services.
So what exactly are peers?
So peers are people with lived experience in substance abuse and mental illness. They have lived experience in recovery. A lot of the job is working with other people and trying to empower them to achieve their goals and to help them to achieve their goals. Also, a lot of my job is being just a confidant to people, someone that can understand and empathize, and we don't have to report to like probation and courts and things like that. So sometimes it's easier for people to open up when they know that it's not like it's just between them and I.
It sounds like a whole new level of service. It's really, really important. Have you found success?
Yeah. When I got into recovery like 7 years ago, and at that point, I don't think that they had peers around here. I didn't have one, it wasn't offered. Now with Oasis, it seems like all of the inpatient and outpatient facilities have to have peers because it's just an extra support, and it's a really nice service. People seem to like it a lot.
So how did you get involved?
So like I said, I didn't really even know what peers were, that was even a job. But before I worked at Farnham, I worked in the emergency room. And I found that one of my favorite parts of the job was sitting and talking with people who would come in for like overdoses or some kind of like drug related problem. And I think a lot of times like people go through those things and they don't have a lot of support or they feel judged. So it was nice to sit with people and tell them, hey, I've been where you are and it doesn't have to be this way. And so then I found that was actually a job, which is what peers do. And so that's how I got involved with all that.
So how can peers be helpful to someone suffering from an addiction?
I think that peers are really helpful in the fact that people don't feel judged. A lot of times the counselors and people in the outpatients, they're not allowed to self-disclose if they're an addict or not an addict. And I know that sometimes that's a barrier with people when they feel like the person that they're talking to doesn't get it and doesn't understand. The other thing is that there's a lot of networking in the peer community. So we work with a lot of the peers in like the Syracuse area, around here, like in the Oswego County. So we have a lot of resources, and we're always sharing those resources with each other as far as like helping people like with homelessness, with just like getting services like in job trainings and schooling and stuff like that. And just also a lot of like DSS. Sometimes that's a really hard thing for people to go through. I know for myself, when I was going through, in the beginning of my recovery, like all that paperwork and everything else, and you can't really focus on anything when you're just trying to get your head right. So it's nice to have somebody that can help you do those things, because sometimes two heads are better than one.
So it sounds like you can do a really lot of different things to help someone. What are some examples of what a peer might do?
Okay, so a lot of the things that I do, like I said, are just helping people with connecting to resources. Another one of the good things is that a lot of my job is mobile, so we can meet people where they're at. Transportation can be an issue a lot. So pre-COVID, a lot of my job was meeting people like at their house or meeting them, to go for a walk or something like that, just so that they are able to talk to people and talk face to face, but they don't have to figure out transportation to get there. Some of the other things I do are like accompanying people to courts, or there's a lot of anxiety with doctor's appointments. Some people have anxiety with dentist appointments. I've been to family court with people, just so that you have somebody else there that you trust, and then we can talk afterwards or beforehand, and it kind of like eases some of the anxiety. Some other things that I've done is a lot of like outreach in the community, trying to work with like ACR to help with the syringe exchange program, because that was something that was really just important to me personally with my own recovery journey. And I started doing Narcan trainings last year when my best friend passed away from an overdose, and things like that. Like there's just so much that you can do with being a peer. And like I said, with the networking and like meeting other people, there's just a bunch of opportunities to like keep working towards the cause of getting rid of this drug pandemic.
Sounds like the peers in general are helping to end the stigma, because people don't, you know, because the peers understand. I mean, that's huge, I think, isn't it?
Yeah, I think that's huge. That's something that I really like a lot is like when I meet people, as far as like, you know, big meetings, when you meet like big people and like legislative meetings and things like that, like you look like a normal person and people respect you because you can speak like a normal person, and then you tell them, well, I'm also a heroin addict, and you know, and then really just ends the stigma.
Yeah, that definitely helps. Can peers help by meeting with loved ones of users? How would that work?
So I have had people that I've talked to who, like if their friend is struggling, I've had people that like would call Farnham front desk and they get connected with a peer just to get resources and how they can help their loved ones. Obviously, like if I'm working with one person, I can't talk to their wife about like things that they told me specifically, unless they wanted me to. But a lot of times it's kind of nice to talk like a family member or something like that, or a friend, to just talk to them of like how they can help, because you know, if you haven't lived a life that's around drugs and things like that, it's hard to really know where to start and how to help. And so yeah, I do some of that sometimes.
Great. Now, how do you become a peer? Can you tell me that? First, you
So
have to have lived experience, right? And then after that.
yep, yeah, and like I said, you don't have to have lived experience specifically with substance abuse, you know, mental illness as well. Also, people can become peers if you are like the family or loved one of somebody else who's gone through it. When I got hired at Farnham, then I went through it's like a 6 weeks of training. It was 2 days a week, but there's classes and stuff where you learn about like ethics and like being able to talk to people and really listen, active listening, and you know, just different techniques of how to get people to open up more and things like that. And then there is a test that you have to take. Right now I still have my provisional because I haven't done my certification test yet, but you do have some time to do all that.
Great. How can someone get more information about peers or contact peers?
So in Oswego County, I think the outpatients here is just Farnham and Harbor Lights. So you can always call like Farnham directly and ask to speak with a peer, and they can connect you with a peer, get more information. There is a national peer line, which I have the number for that. That is area code 631-471-7242, and it's extension 1217. And that people can use if they're having some kind of, you know, crisis, or they just need somebody to talk to as well. But like I said, a lot of times you can just call the, you know, like a rehab or outpatient or inpatient and ask to speak with a peer. They can normally connect you.
Most of the places anywhere in New York State have peers now?
Yes. As far as I know, yeah.
Okay, wonderful, wonderful.
Yeah. Yep.
Great. Anything else you want to add before we close?
I do want to say that like for myself, like with working with substance abuse, it has taken something that was like one of the worst times in my life, and has been able to change my perspective on it to being something that has, has been able to be really helpful. I know, like, it's hard to think of going through all those things and like, how can I make that make sense in my life? But it's really given me some kind of purpose for that time in my life, so it doesn't feel as negative in my head. And it's also really nice, like having a child that, she gets to see me do these kind of things and help other people. And I think it really helps my daughter to be more empathetic and end the stigma early on and things like that. So
Thank you so much for sharing today. I think it's important to get all the information out to the community.
yes,
Thank,
thank
thank
you
you
so
again.
much.
Thank you again.